Hello everyone, my name is Shabana Bujawan and I will be doing a NACOSCE video today on abnormal uterine bleeding. So this is most likely going to be a history station and I have a few tips for you today. Read the description carefully on the door. This will tell you how long you have for your history and if there will be any questions asked by the examiner in the end. When you're there in a NACOSCE, you have 10 to 12 stations. You're going very quickly between stations. Don't try to think about, oh my God, did I answer the questions correctly from the last station? Did I get a diagnosis correct? When you're standing in front of your new station, just clear your mind of all of those things. Focus on what is in front of you because that scenario on the door is going to give you some tips, going to give you some hints on how to steer your station. And if it's a history station, if it's examination, what you need to do. Leave time for the examiner to ask you questions at the end. Leave at least 1 minute if they do not tell you that the examiner will be given questions at the end. Leave at least 1 minute so that if the examiner does not have questions for you, you can at least ask the patient anything if you forgot. The worst thing you could do in these stations is sit there and have time elapse and there's a long period of silence. So, if there isn't anything, maybe just establish some rapport with the patient, talk, do something. How do you ace these? Practice, practice, practice. You need to practice with people who will be able to stop you, correct you. That way you'll be able to know, okay, this is the amount of time I have. This is how long that am I getting everything done. Okay? So let's go straight into our scenario. 21-year-old female complains of prolonged excessive menstrual bleeding. This has been occurring irregularly for the past few months. You have 7 minutes to take the history and then 3 minutes for the examiner to ask questions at the end. So already they tell you how long you have. They give you a little bit of a case. Okay, this is what you need to be thinking about. So you already know this is going to be a gynecological history. And so you already have your gynae history in your mind. These are the things you need to ask. And that's why it's important to practice. Okay. So the first thing here, you're going to knock on the door and enter. Don't wait for them to call you and knock on the door, enter. You will have to give the examiner your candidate number. Or maybe verbally tell them, I'm not sure now what it is. And then you go straight to the patient. Smile, hi, good day, introduce yourself. You are not a doctor yet, so don't say, I am Dr. So and so. Smile and say your name, first and last name. Ask for the patient's name because they did not give it to you on the door. This helps establish rapport. You can even ask them how old they are, even though they gave it to you on the door. But it helps give you a sense of, okay, this is my patient's name, this is their age. And this patient has been bleeding for a prolonged period of time. So the first thing you want to do, you do not know how long this has been. It's been a few months, I think. You don't know if this patient is stable. You do not want to sit there, take a 7-minute history from somebody who is not stable. So you turn to your examiner. Can I have this patient's vital signs, please? Most likely they are going to tell you the vital signs are normal, or they will give you a blood pressure and a pulse that is normal. So it's important for you in this kind of case scenario to say, okay, this patient has been bleeding for a very long time. Are they stable enough for me to take a history from them? And then once you know the vital signs are stable, you go back to your history. So the first thing that's important in these histories is establish a menopausal status. But the age was given to you. This is a 21-year-old young female, so you already know she's not in menopause. So you know her her menopausal status. The other thing you want to do is dive straight into your history. Start quantifying your bleeding. You want to know the duration. So how long has this happening? They told you a few months. So you need to figure out from your patient, you need to get that history, how long. Quantify the amount of bleeding. So people use pads, some people use tampons, some people use pads and tampons, some people use clots. We are not here to discriminate against anybody on how they use, but what we need to do is find out how much of this bleeding is happening. Is it half soaked? Is it fully soaked? And are there clots? Because clots tell us that the bleeding has been, clots tell us the amount of bleeding that is happening. Also, sometimes if the patient is being a bit difficult, sometimes they may say it varies on different days. Sometimes it's heavy, sometimes it's not. So you want to know most of the days, most of your in that month or whatever, how was it? Was it half, full? And then on your heaviest day, how much did you use? So these are just guides to help you if you do have a patient that is just unsure um, about quantifying their bleeding. Then you want to dive straight into your menstrual history. So, what age did you have menarche? When did you start seeing your first period? Are your periods previously regular or irregular? This is important to find out. Is this something new? Is this the first episode, or has this always been happening? Is this just excessive this time? If they say that they have their periods regularly, then you need to find out how long it usually is. Um, and you go into like what their normal period is like. So maybe their period lasts from normally 5 to 7 days, and they normally um, use 1 to 2 pads a day. It's half soaked, no clots. Okay, but this is completely different. And then you want to ask about painful periods. So, do you normally have painful periods? And you need to quantify: is it before the period starts, or is it during the period? Okay. And then you want to continue with your history here. You want to find out their priority. So, have you ever been pregnant before? Um, and if they say yes, you need to quantify. You need to find out, okay, how many living children do you have you ever had any abortions or miscarriages? Because this could actually be a miscarriage. Could this patient be pregnant? So you should ask here, have you done a home pregnancy test? Okay. um and then first day of the last normal period. So if they have if they could remember, what is the first day of their last normal period? um could this bleeding be associated with their period? So maybe their period started but it just got prolonged, or is this a bleed outside of their regular period? Okay, so now we're going into, so we've gotten our history, we've gotten our gynae history, and now we're going to go into the review of systems. So what we're trying to do here in the review of systems is we are trying to rule out other causes of abnormal uterine bleeding. So the first thing we want to know about is vaginal discharge. Is there any vaginal discharge? If yes, you need to quantify it. So what's the color, odor, is it thin or thick? Pelvic or abdominal pain. Is it pain? So if they say yes, you need to, and this means right now, okay, not with their periods. Do you have abdominal pain or pelvic pain with this bleeding? Is it right or left lower quadrant, or maybe even back pain associated with endometriosis? So we're trying to get a picture here of what is causing this patient's bleeding. Are there any urinary complaints as well? So asking about dysuria, increased frequency, any color, odor, or nocturia. History of trauma. So this is a sensitive thing. Okay, so we might think trauma just be as was this person involved in a car accident? So we're looking to that motor vehicle accident. But we do have to ask about their last sexual intercourse, because um, we're looking here for, is there sexual abuse? Because could this be a cervical laceration? Um, so this is a sensitive question, and we should tell the patient a little before. I do have to ask you a sensitive question, and then you go into it, because you want to show the examiner that you are compassionate. You want to show the examiner that you can build rapport with this patient. Because once you build rapport and you develop that doctor-patient trust, then the history will go smoothly, and you would get what you need from your patient. Okay. uh any history of easy bruising or bleeding. So what are we looking for here? We're looking for von Willebrand disease or any clotting factor deficiency. And von Willebrand disease is very common in our women. So any history of abnormal pap smears. You need to know when was their last pap smear, and it's very important for you to know the schedule in Canada for pap smear. So once what age they start, 21, So she is now 21 years old, because you don't want to go and be asking a 17-year-old about pap smears, right? It just tells the examiner that you don't really understand. Um, you don't really understand the schedule. So you need to know the schedule. It's different in different provinces. Um, so you need to know the schedule for pap smears and medications. Are they on any blood thinners? This can cause bleeding, as you know. And then are they on any contraceptives? Because if they missed a day, maybe if they weren't taking it right, maybe even they got like the depot injections and they're having a breakthrough bleed. So all of these things are important to ask about contraceptives. And I put here thyroid symptoms because hypothyroidism can actually cause abnormal uterine bleeding as well in a young female. So we need to rule out if there's any tiredness, malaise, weight gain, hair loss, constipation, cold intolerance, poor memory for hypothyroidism. And then you want to complete the rest of your history, okay? So past medical, past surgical, allergies, family history, social history. And these should be really quickly run through, because the majority of your history you're already guiding yourself towards a diagnosis. So what are our differential diagnoses here? So the first thing, once you finish with your history, you give that social history, you say thank you to the patient, you smile, and you turn to your examiner and you try to give a summary. Try your best. This is a 21-year-old female presenting for the first episode of prolonged menstrual bleeding or prolonged abnormal bleeding. She's a currently stable condition. My most likely diagnosis is. You should have that small summary at the end. And then what about our differentials here? What are we thinking? So we talked about coagulation disorders and von Willebrand's disease. So you need to know how you're going to work that up. You are not sure about what questions the examiner is going to ask you. Maybe the examiner might tell you, okay, what investigations would you like to do on this patient, or what would you like to do from here? So from here, you want to do your physical examination. You have not examined this patient. Um, you got the pulse and the BP, but you don't know the rest of the examination. You need to do a full examination for this patient. So you'd start there. Then you'd want to do some investigations to work up this patient. So first thing we do would be your urine pregnancy test. If the patient said that she was sexually active, if the 21-year-old has never been sexually active, you don't want to jump to a pregnancy test, right? So it all depends on where the history is steering you. So if she said yes, she's been sexually active, you first thing you need to do after your physical exam would be a urine pregnancy test. Then you do your so in your physical exam you would have done an abdominal exam, a pelvic exam, and at the pelvic exam you would be examining the vaginal wall, the cervix. You may even take a cervical smear here, so you can say that this patient may even qualify for a pap smear, which you can do at that same time. And then blood investigations, we're looking at the uh, complete blood count, because we're looking for things like she said she's been bleeding for a long time. Does this patient have anemia? Um, we're looking at their platelets. We want to do their uh, thrombin and prothrombin time. So all of these things will hint to us whether there are any bleeding disorders. We talked about cervical biopsy or cervical culture if we think there's a discharge. Our molar pregnancy, we'll be doing our HCG to see that, or we could even do a serum HCG if it comes back as positive. And this is something that you can do urine pregnancy test in your doctor's office very easily. We talked about hypothyroidism, so if we do have suspicions about that, we should be doing our TSH. We should also be doing our LH and FSH. And then we should be doing a glucose stick. So we should be doing a glucose test and then a fasting glucose, because diabetes mellitus can also present like this. So again, these will be your most likely differentials for this patient. And again, you just need to answer in the way that like what the examiner has asked. So that is the end of my slideshow. Good luck with your NACOSCE. I know it's an expensive exam. I know that you have been preparing for a very, very long time. So, and I know you want to be a doctor here in Canada, you will be. Just keep practicing. Um, try your best to talk to other people who are in it so that you get some good feedback. People who are also doing the NAC, so that you can study with them, get feedback, so that you know how long is your time in, and if you need to ask any other pertinent questions. So good luck, everyone, and I hope this video was helpful.